Hello, I'm Dr. Sylvan Palmer, a neurosurgeon here at St. Joseph Health Mission Hospital. Over the past 30 years, I've performed more than 10,000 back surgeries. In that time, I've treated patients much like yourself. Patients who suffer pain and discomfort because of an accident, sports injury, congenital deformity, or sometimes just a simple day-to-day wear and tear of an active lifestyle. As a surgeon, I can tell you that surgery is not always the answer to correcting back problems. Often physical therapy and the training received during that time can solve a multitude of problems. Here at Outpatient Rehabilitation, the highly trained physical therapists provide care, education, and training techniques which will help ease your pain, strengthen your body, and provide you with ways to help prevent re-injuring yourself. This is Delita Dwyer. Delita is just one of the physical therapists here at the Rehab Sports and Wellness Center. She, along with the other top-notch members of the therapy team, work with patients every day to help them gain more mobility and strength and regain a more active lifestyle. Delita is now going to tell you more about the center and show you some of the great things that go on here. Delita?
Thank you, Dr. Palmer. As Dr. Palmer mentioned, patients come here seeking help for a variety of physical problems. Many suffer from back, neck, shoulder, hip, knee, or ankle and foot injuries. Sometimes it's a combination of several of these problems. Whether you're here facing surgery, have just come through a surgical procedure, or have had physical therapy prescribed by your doctor for your injury, my colleagues and I will be addressing your problems with the most comprehensive and state-of-the-art treatments. As physical therapists and orthopedic clinical specialists, it's our goal to ease your pain, strengthen your body's core, and show you ways to improve your body mechanics. We will also be teaching you new methods for conducting your day-to-day activities so that you don't re-injure yourself during and after recovery. But before we go any further, I'd like to acquaint you with our facility so that while you're here, you feel more comfortable. When you come through the door, you'll check in with the front desk staff. After your treatment, it's here that you can make any additional appointments, changes in scheduling, or get answers to any questions you may have pertaining to insurance benefits or co-payments. To the right is the gym area. Many patients, former patients, and even staff and medical personnel work out here under the supervision of trained staff members. While you're a patient here, your therapist may bring you in to show you how to work out safely. Membership in the gym is not mandatory, but the fees are nominal and the location is convenient for many. Whether here or elsewhere, finding a good gym is often strongly encouraged once your therapy is over. Now, let's see more of the center. Down this hallway are the various therapy areas. Here's where you're going to be spending most of your time. At the far end are areas designated for speech therapy and occupational therapy. Here in the center of the room is physical therapy. From bikes to balance bars, exercise balls, and hands-on manual therapy, this is where you'll experience a comprehensive program designed and incorporated by your physical therapist. A bonus many clients enjoy after a session is time on the table with hot packs or ice packs to treat sore muscles and stressed tissues. Regardless of what has brought you here, the fact is we all abuse our bodies. Here's a question. How many of you are guilty of using your back in ways it was not designed to move? Watch what I mean. In each of the scenes, the individuals fail to engage their core and don't use their legs, hips, and shoulders properly. As a result, an abusive amount of strain is put on their spine, vertebra, and discs, and that can spell trouble. Did you see yourself in any of those scenarios? Sure you did. We all see ourselves there in some way because we all misuse our bodies at some time or another. In the next few minutes, and certainly during your time here at the Rehab Center, we'll be showing you ways to avoid those bad moves and teach you new moves so that you stay safe and will be less likely to hurt yourself again. The human back is like a strong machine. When it's working properly, it does some phenomenal things. The work center of the back is the spine, which is divided into 3 sections. The cervical, or neck, at the base of the skull, the thoracic, including the rib cage, located at mid-back, and the lumbar section, often referred to as the lower back. The spine is constructed in such a way that when used incorrectly over time, becomes susceptible to injury and even on occasion suffers permanent damage to the discs, vertebra, and nerves extending from it. This can cause severe pain and limited mobility. To help you better understand what happens when your back and spine are traumatized because of an accident or a bad twist, lift, or bend, I'm going to show you several demonstrations which I hope will make the point more clear and help you remember the corrected methods you'll be learning here in physical therapy. Between each vertebra is a gel-like substance called the disc. It cushions and protects the vertebra each time the back moves. When a movement is done incorrectly, say a twist or a bend, the gel shifts and can eventually move out of the disc space and onto the adjacent nerve, which causes pain and discomfort. This marshmallow cookie provides a visual example of what can happen. Just like the vertebra and gel, when pressure is put on one side of the cookie, the marshmallow substance shifts to the other side. If we press harder and longer or repeat the sequence often enough, the marshmallow substance begins to protrude. When this happens, the bulging disc puts pressure on the surrounding nerves and at times even ruptures, causing severe pain. One of the most common mistakes we all make is in the way we sit. Sitting improperly puts a lot of unnecessary pressure on the discs in our backs. We all know that slouching is bad, we still do it. Let me show you the correct way to sit in order to protect your back. First, you're standing at the chair with your feet hip-width apart. You can scoot back so the backs of both your knees touch the back of the chair. You can also use your hands, and you want to lower yourself slowly, and you want to sit down on your sit bones, not onto your tailbone. Now, another way you can also sit is scooting back into the chair using a lumbar cushion. So when I push myself back in the chair, the lumbar cushion fills the small of my back, preventing me from slouching. Watch what happens when I remove this lumbar cushion. Watch what happens to my back. There we go. And now I'm slouching, putting all of that pressure on my low back. So there's 2 ways you can sit. You can use the lumbar cushion, like this, or a pillow. Or you can scoot, if you don't have one, to the front of your chair, kind of with your feet, again, hip-width apart, sitting up tall, sitting on your sit bones, and avoiding slouching. So, to help you remember this, I've devised a special demonstration. For this, I'll need some assistance. So, Eliza Stein will be helping me. It may be hard to believe, but if you sit properly, you can actually sit on an egg without breaking it. To prove my point, I have 2 quail eggs here. Thank you, Eliza, that I'm going to sit on to show you the difference between sitting properly and sitting improperly. First, I'll demonstrate what improper sitting or slouching produces. Now I'm going to hand Eliza the egg, and she's going to put it under my tailbone. Now, I'm going to sit up, and I'm going to slouch, and you're going to see what happens to this egg when I slouch. All right, Eliza. This poor egg never had a chance. Now with the second egg I'm going to give Eliza, she's going to put it in the same exact place under my tailbone. But this time I'm going to sit up tall using my core, and I'm going to put all the weight on my sit bones and not on my tailbone. So now I'm sitting up nice and tall, and I'm going to lean forward. She's going to remove the egg, and you're going to see that the egg is still intact. And I want you to look. And in case you were wondering, this is not a trick with a hard-boiled egg. While the egg is a fun demonstration, I want to show you some more examples of how to use good body mechanics in order to avoid back problems. Improper bending, lifting, and twisting are three of the main reasons people develop back problems. What would seem to be the simple act of bending over to pick up groceries out of a basket and placing them in a car is in clinical terms a very complicated maneuver for the human back. It involves what we call the BLT, not the sandwich with bacon, but the bend, lift, and twist, which can all be troublemakers for back patients. Most of the problems exist because we don't anchor ourselves properly or use the strength from our legs. Let me show you what I mean. As I noted earlier, slouching is not proper posture, but neither is a constant, rigid military stance, often referred to as at attention. Proper standing position uses the same guidelines as our earlier demonstration on sitting correctly. For instance, we keep our feet hip-width apart, keep the knees soft, our core tight, and now our shoulders are down and back with our chin slightly tucked and our chest relaxed. This gives you better balance and distributes your weight so there's no extra pressure on your spine. One last maneuver I want to show you will serve you well during your treatments here and at home. It's getting in and out of bed or on and off a therapy table. The maneuver is called the log roll. Begin by sitting on the side of the bed or table. Lock your core here within your abdominal area. Slowly lower yourself sideways using your arms in what might be called a walking manner, one over the other until you reach the pillow. As you lower your upper body, slowly lift your legs and pull yourself into a fetal position. Then, keeping your core locked, roll onto your back. When getting up, reverse the maneuver. Lock your core and log roll onto your side. Use your hands again to start pushing yourself up, hand over hand, and at the same time begin lowering your legs over the side. Don't rush getting up, do it slowly and safely. Your therapist and I want you to use the log roll every time you get on or off the therapy table or in and out of bed. While in bed or on the table, put a pillow between your knees or under your knees to reduce the stress on your lower spine. Make this a habit and protect your back. Now that I've shown you some new moves to protect your back, let's look at those bad moves we saw earlier, but this time let's see them done correctly. As you can see, this woman now slows down, works in stages, and turns her body rather than twisting it. This gardener engages his core, bends his knees, and uses the strength of his legs to lift the heavy planter. The golfer extends her one leg in order to maintain balance and avoid pressure on the lumbar section. And finally, this granddad keeps his knees soft and bent, feet apart, and braces safely for a big catch. As you can see, it doesn't take much to correct bad habits and ensure that you don't suffer more pain or risk further injuries. Earlier, you met Dr. Sylvan Palmer, a preeminent neurosurgeon at Mission Hospital. Some years ago, I was a patient of Dr. Palmer's. I had suffered a herniated disc after a bad fall, and he operated on my lower back. So, like you, I too am a recovering back patient. Today, after the surgery, physical therapy treatments, and a comprehensive exercise program to strengthen my core, I enjoy a full life. I bike, ski, and work a full schedule here at the center. One of the most important things for you to know and remember as you go through therapy is that the pain, discomfort, and lack of mobility that you're experiencing now will get better. There may be some things you won't be able to do the way you did before, but most of the activities you've enjoyed before, you'll enjoy again. And if you follow the techniques you learn here, you'll stay stronger and healthier than before. One last thing, it is not uncommon for some of our patients to return for additional therapy. You may be one of them. Don't worry, we like to call it tune-ups. It's important for you to know that if this happens to you, it's not a setback, but an opportunity to review and possibly modify your home exercise program. It can also be a time for you and your therapist to reset your health goals while addressing any pain or discomfort that may have returned. Whether you're here for the first time or returning for additional treatments, we look forward to working with you in your recovery.